So to start us off, my name is Kathy. I know my name says Catherine on the video, but please do call me Kathy. Nobody calls me Catherine. I'm a fourth year student in health geography here at McMaster, so you don't have to call me doctor, you don't have to call me professor. I'm just the instructor for this course, so none of those formalities are necessary. You can reach me at slavicc@mcmaster.ca. That's my email address. It's also listed on the syllabus, so if you ever need to get in touch with me, that's probably the best way to do it. Now, why am I teaching this course? I'm not a professor, but I do a lot of research in health geography, and it's always been a passion of mine. So long story short, that's kind of what brought me to this course and brought me to this field in general. But like many of you, I started out as a student in environmental science. So originally my interests were really focused on the environment. It wasn't until I took a third year health and geography course at U of T, where I did my undergrad, that I started to think, oh, this is actually pretty interesting stuff. I had never really made those connections between how the environment, how geography plays such a big role on health outcomes and people's health. So that's sort of what brought me here. I am going to turn it over to one of the TAs, Sophie. So the way that this course is going to work is that every lecture, one of the TAs will be there to sort of help me out at the beginning, just to make sure everyone gets admitted pretty smoothly, but then they won't stay for the rest of the lecture. So you won't see them throughout the lecture, just sort of at the beginning. But Sophie, if you want to go ahead and introduce yourself, maybe say a few words.
Sure. Hey, everyone. My name is Sophie. I'm one of your TAs. I'm a second year PhD student. I work under Dr. Allison Williams, and I study the geographies of care and caregiving, and specifically the geographies of LGBTQ caregivers. And I'm excited to see all of you in about, not all of you, some of you in about 2 hours. So it's happy to be here.
Great. Thanks, Sophie. With that said, if you want to stick around just for maybe a couple more minutes, because I see that some people are still entering the waiting room. But after that, you're free to go off and prepare for your own tutorials. Okay, so how will this course work? As you may have noticed, there will be 2 scheduled live Zoom classes per week. The reason I opted for this option, I kind of went back and forth for a good few weeks thinking about whether to just pre-record these or to offer them live. I wanted to give you guys the opportunity to actually stop me during a live lecture, to interrupt me, ask me questions, get clarifications on the spot, not have to wait until you see your recording and then reach out to me over email. I just figured this would be a lot easier for all of you. That being said, participation, questions, all of that are very, very welcome. Like I said, on-camera appearances are not necessary. They won't be viewed, certainly on the recording. So if you're shy, you won't have to worry about that. But of course, it does sort of help us instructors, and I'm sure your TAs will tell you the same thing. If we see some faces, it sort of makes us feel a little bit more real versus talking to a bunch of black screens, but totally up to you. Pajamas are acceptable. I know it's early in the morning for a lot of us, so don't worry about that. That being said, because the questions that you may or may not ask over the course of a lecture, especially in the chat, I might not see them right away. So honestly, the best way to get my attention, especially if you just want to interrupt me with a quick, oh, can you go back to the last slide? Or sorry, can you hold on? Something wasn't clear. Just speak up. If you feel comfortable turning on your audio, that'll be the easiest way to sort of get my attention right away. Do you have to attend the lectures every week? This is sort of up to you and how you feel you can make the most out of a course like this. Certainly, the course pace will move pretty quickly, and the lectures really tend to build off one another. I'll spend a lot of time sort of tying concepts back to previous weeks. So, if you miss a lecture and you don't have enough time to watch the pre-recorded lecture afterwards, or not pre-recorded, but post-recorded lecture afterwards, it might be a little bit harder for you to sort of keep up with what we're talking about. But I'm not taking attendance in these lectures. There are simply too many of you to do that. So, it's sort of up to you how you want to treat these lectures. Definitely, it'll be to your benefit if you attend them as regularly as possible. Worth noting, you do have tutorials every week, and they start this week. So make sure to attend those tutorials either later today or tomorrow. Your attendance there will be marked, so you definitely want to show up to those regularly every week. think that's all I need to say about the course stuff. So what is this course about? Essentially, we're looking at a lot of global and local patterns of mortality, so death, as well as morbidity, disease. And, you know, these are pretty core concepts from any sort of health related course, but specifically what makes it unique to this type of course is that we'll be examining how a multitude of factors like spatial, ecological, cultural, social, economic, demographic, and a whole bunch of others, how these types of factors impact health, so how they might impact mortality or morbidity. We'll also spend a lot of time learning about how we actually study those patterns. So what are the methodologies that we use to look at some of these things? And just a heads up, you know, the first couple of weeks of this course, we'll spend a lot of time talking about these types of methodologies, how we actually approach concepts in health geography. So, you know, don't be turned away by some of the sort of boring stuff that we have to cover in the first couple of weeks of the course. I promise you things will get a lot more exciting after that, but it is stuff that we sort of have to get out of the way at the beginning. Other than that, you'll also get plenty of experience assessing and interpreting evidence from health studies. So this will be particularly relevant for your assignment 1, where you'll be doing a critical appraisal and you'll have to read 4 studies in quite a bit of detail and really learn how to interpret results that are presented in them. You know, what are key findings? How do you actually find them in a research article? So that'll definitely be useful throughout your academic careers and going forward. Lastly, you'll also learn how to synthesize health information to make conclusions about the role of geography, so locations or places on health. And again, this is, you know, a really core piece of this course, but I hope that you'll see as we go through the course how useful that is just in real life. Because where we live, obviously, where we work, it does shape our health in very significant ways. And so we'll spend a lot of time talking about some of these things. Can I just quickly ask you guys, how's the audio? Do I need to speak louder? Can you guys hear me well? If anyone wants to pipe in. It's good. Okay, great. Okay. What else will you explore in this course? So some pretty key questions that we'll try to address are, you know, how do I know if exposure to substance A in area B cause diseases related to C? Why do 2 people with very similar characteristics who live in very different places experience very different health outcomes? On the other hand, why do 2 different people living in the same place experience the same health outcomes? So these are the types of things that we'll start to unpack over the course of the course. And I will definitely try my best to present lots of examples to try and make it as relatable to as many of us as we can, going from both local as well as global contexts. Since I know a lot of people do have an interest in global health, we'll try to tie in some of that as well in this course. I should also mention that the way that I structured this course, I'm really starting from sort of broad factors and moving into more narrow factors. And hopefully by the end of today's lecture, you'll sort of understand what I mean there and what I'm talking about when I talk about different scales and things like that. So everyone always wants to know how you'll be evaluated. As I mentioned, tutorials do start this week, so definitely please attend those tutorials either later today or tomorrow. Many of you met Sophie earlier, so Sophie will be one of the TAs, and then the other TA who will be joining us in lecture tomorrow, I'll give her a chance to introduce herself as well, for those of you that won't meet her until tomorrow. But essentially, tutorials are, you know, a pretty big chunk of your mark, 30%. And the way that that's divided is evenly between something we're calling a case study presentation. And I will not spend much time talking about that today because your TAs will go and talk about it a lot this week in tutorials. So there's no point in you hearing that twice. But yeah, hopefully by the end of today or tomorrow's tutorials, you will be fully aware of what that's all about. And of course, if you have questions about those, then please ask your TAs. The other half of your tutorial marks will be related to participation. And I think your TAs will also go on to explain this, that it's not going to be enough to just attend the tutorials. The kind of point of these tutorials, the way that we've set them up, is to try to engage you guys and to try to get you guys to discuss things with one another and participate with one another, because I'm sure after already one semester, or I guess almost 2 semesters of online classes, you're getting a little bit tired of this. Hopefully you're craving some of that face-to-face interaction with your peers. So we're going to try our best to try to initiate some of that in those tutorials. So definitely you'll want to participate and try to attend those regularly to get all the marks that you can there. The rest of the marks, so 40% are related to assignments. You've got assignment 1 and 2. The first assignment is a critical appraisal. And again, that's worth 20% of your mark. The critical appraisal, I'll spend a little bit more time talking about that tomorrow as well as next week. So I won't cover it in much detail today. But I did post the assignment guidelines on Avenue. So if you are particularly curious or keen about what that assignment's about, then you can access it there. Assignment 2 is going to be a reflection paper, and that's not due until pretty much the end of the term. So I don't expect that many of you will have questions about that just yet. But again, we will talk about it more towards the end of the term. And then we'll end the course with a final exam. It will be cumulative. I haven't quite decided on the structure or the format or anything like that just yet. So we'll kind of revisit that at the end of the term. And that'll be worth 30% of your marks. Are there any questions about this stuff before I move on? Oops. Hopefully it's pretty clear. Nope. Okay. So this is the point where I ask that hopefully some of you will volunteer to be note takers. We do have a few students in this class who would really benefit from note takers. So if you plan to be attending classes regularly, if you know that you take pretty decent notes, and if you want some incentive to take perhaps even better notes, then this is probably a great opportunity for you. You'll get a letter of reference, great volunteer experience, so you can pat yourself on the back afterwards. But hopefully you'll also see an improvement in your own note taking, which is always a plus. So please, if you're considering it, definitely do so, and you can apply online with the website that's listed there. So hopefully some of you can volunteer for this initiative. Now, this brings us to some of the fun part of the course. Why are we studying health and place? Why is it important? Well, to begin, what do we actually mean by place? What does place mean? So place is a concept in geography, and there are many ways to describe place. In fact, you might hear words like sites or settings or areas or locale, but do these mean the same thing? Well, if any of you have done the reading that was posted on Avenue, so chapter 1 by Gachel and Elliott, they do actually differentiate between things like place and location. So these can mean very, very different things. As much as possible in this course, we're going to try to not mix them up. So hopefully by the end of today and over the course of the course, you'll get to really solidify what it is, that difference between location and place. And even though people will mix them up all the time, especially outside of this course, now that you'll have that knowledge, hopefully you won't have to do it again. So what do we mean by location? Well, it's a fixed area or a set of fixed points on a map. So for example, in the image there on the slide, you see a Burke Science Building, so the lower image. You see that it's a particular point on a map, right? It's a distinct location on a map. We can contrast that with the above image. So an image of BSB as a place. And what place means is essentially some sort of symbolic location. That means that it has meaning or that it has some sort of feelings attached to it. Maybe the picture there reminds you of some course that you took that you really liked in BSB. Maybe it reminds you of a course that you didn't really like that you took in BSB. But either way, often we associate those places with particular feelings or attachments or some kind of meaning behind them, versus location, we just mean a specific place on a map, essentially. So in health and place, in most health geography courses or concepts, we are often interested in the relationship between two locations or two places, and we often measure them by some sort of measure of distance. And this is what we call relative location. So important to note, location and place are not the same thing. Now, what is scale? It's important to think of scale because especially when we're comparing the health of populations, we need to set boundaries around those populations. So are we interested in the health of people living in a neighborhood? Are we interested in the health outcomes of an entire city? Or is this, a global health issue that many populations all around the world are faced with? So scale is very, very important from that perspective. Now, why does that matter? Why do you guys think that might matter? Any ideas for why scale is so important to think about in the context of health? If anyone wants to speak up or share in the chat, why do you guys think scale is important?
Because different scales would have like different patterns of health depending on like their location.
Yeah, so you definitely hit a point there. Patterns. It's important to study patterns. Some people in the chat have mentioned important considering pandemics versus epidemics. Yeah, that's definitely a critical concept, especially today. The amount of people affected. Yep, that's another good point. Any other ideas? So we need to know the extent of the health problem. Yeah, so I think some of you are definitely right on there. Transmission of disease. Yep, that's also a really, really important point. To understand the magnitude of reference. Yep, exactly. So yeah, scale has a really, really important impact on all of these things. Now, what's also important to note is that it has impacts on prevention and the treatment of diseases. So yeah, how we actually approach something like a pandemic or an epidemic is very different depending on the scale. And yeah, someone mentioned identifying patterns. So these are all really, really important parts of scale. And this is why we'll talk about scale throughout the course. And it's really sort of one of those fundamental concepts that we'll revisit a lot. Just as an example, especially in light of COVID, it's not particularly helpful to compare COVID cases in a Toronto neighborhood versus the whole province of Quebec, right? To be able to make those patterns or those comparisons, we really need to compare scale with scale. So it's not a good thing to sort of mix different scales up when we're talking about health and disease. Now, what if I told you that most households in the world do not have a street address? So most people who live on this planet do not have an actual physical residential location, in other words. What impacts do you think that this has on a person's life? What do we need an address for? Can't get a job or receive mail? Yep. Any other ideas? What do we need an address for? For ID? Yep. Makes gathering data difficult. Yes, that's for sure. Tracking diseases? Yep. Applying for a credit card. Yeah, so you guys have lots of great examples here. Some of the ones I've put up. So receiving mail or deliveries, think about how important Amazon deliveries have been in the context of the pandemic. Opening a bank account, enrolling in school, even voting. You need, especially here in Canada, to have a elected local representative, you need to have an address associated with whatever district that you're voting in. And of course, obtaining a health card or other ID is also very important. So, these are pretty broad impacts. Now we're going to spend a little bit of time thinking about how it could impact people's health. So to begin, what do we actually mean by health? What is health? Well, the World Health Organization defines it as the complete state of physical, mental, and social well-being. So 3 kind of core aspects of that definition. But as you can imagine, it can be pretty hard to track someone's physical and mental and social well-being, especially all at the same time. So how do we actually measure all these complex aspects of someone's health? Well, we tend to think of health as the absence of disease or illness, but do these mean the same thing? Disease, we generally know, requires some sort of medical diagnosis. That means that you require testing. You have to go through, a sort of rigorous criteria to actually meet the criteria of what a disease is being defined as by a given physician or by a medical establishment. So it's not always so clear-cut whether someone even has a disease or doesn't have a disease. An illness can simply mean feeling unwell, right? It doesn't necessarily mean that you need to take a test in order to feel an illness. You just have to not feel like you're at your 100%, essentially. This is particularly relevant. I don't know if any of you guys have seen the show Diagnosis on Netflix. Anyway, I just started watching it recently, and it was really interesting to see that we simply don't know a lot about disease diagnoses. Especially rare diseases with many different symptoms that might look like one disease, but they could actually be a host of other diseases. So people tend to have this assumption that, it's a very simple thing. You either have a disease or you don't. But in fact, it's a lot more complicated than that. And I think we'll also come to realize that throughout the course of this course. So another sort of key aspect of studying health in place or health geography, another aspect of studying patterns, is understanding time, because as we know, someone's health status is not stagnant, right? They can be feeling healthy one day, but they can be feeling ill the next day. So in this course, we'll talk about temporality, so time, as something that's really, really important to consider. A key sort of concept here is disease latency. So latency is definitely one of those words that you want to remember from today and from the rest of this course. We'll revisit a lot. And so latency basically means that it's this period of time that it takes to develop symptoms or to develop a disease from the time that you were exposed to something or that you were exposed to some determinant of health that is associated with that disease. So, for something like cancer, the disease latency might be very long, right? It might take several years for any sort of metastasis to occur in the body. In other aspects, something like COVID might have a very short latency. It might only be 14 days, for example. So the duration and timing of health and disease is really, really important, and it's something we'll talk about a lot. Another thing I wanted to bring up is this aspect of critical exposure period. So for example, teratogenic agents. If I can bring your attention to the figure there on the slide, it's really showing the set of birth defects that could be associated with a fetus if the mother consumes alcohol during particular periods of time during her pregnancy, right? So something that we call critical exposure periods. And so that we know that as the child is developing over the course of the full time of gestation, so 9 months approximately, consuming alcohol, but also a slew of other substances during particular times is associated with particular impacts. So if I asked you guys, looking at this figure, what is the critical exposure period for potentially developing defects related to the arms? What would you guys say? So related to arms. Between 4 to 8 weeks, yep, approximately, or I guess 4 to 7 weeks. So now I also want to spend some time talking about how location or place can directly determine your health, now that we have a sense of what all these things mean, place, location, and health. So for example, ways that we imagine that it directly impacts your health can be something like distance, right? We can measure distance very directly. So your distance to a hospital could be really important in determining your health. In the figure there I have on the slide, this was a study that looked at distance to hospitals and your risk of mortality. So they found that the further the distance, especially when you compare, less than 10 kilometers compared to more than 20 kilometers, it increased your risk of mortality quite significantly. This is a pretty big problem, as you can imagine. Not just globally, but even here in Ontario, not everybody lives within 10 kilometers of a hospital. So this has potentially, pretty big impacts on the health of a number of people who live even in a place like Ontario. And in this particular study, they found that respiratory problems were particularly associated with an increased risk of mortality. Now I'm highlighting this because, again, unfortunately, we are living in this time of COVID and respiratory problems are sort of top of mind. And so this plays out into some pretty key decisions that people who drive ambulances, for example, have to make. Do we drive to a further hospital that has particular equipment that we know might help this patient more? Or do we risk, that distance and just take them to a hospital where they can at least receive some other type of care in the meantime? These are unfortunately really hard decisions to make for a lot of caregivers or care providers, medical experts. But unfortunately, it is a decision that they often have to make, especially in rural parts of places like Ontario. Now, other ways that location or place can directly determine your health are, as simple as proximity to pollution sources or proximity to grocery stores. Can you guys think of any other examples? So how it can directly determine your health? Any ideas? Quality of healthcare in an area? Yep. Parks and recreation centers in the neighborhood. Absolutely. If you have access to something like basketball courts in your neighborhood, you're probably going to play basketball a lot more and hopefully be more physically active by that measure. Any other ideas? Yeah, so I think you guys kind of understand that. That being said, on the other hand, there are many ways that location and place can indirectly determine your health, right? So the measures might not be so directly measurable, they're indirect. For example, living in a neighborhood that feels unsafe, living in housing that's not particularly well maintained, living next to a park. Although it can directly impact your health by maybe making you more physically active, living next to a park can also just make you feel better. Maybe you have less anxiety when you're surrounded by things like nature, right? Working in a place can also provide quite a few different stressors. So job stressors, especially in that figure there I have, these can impact stress in a lot of ways, which we know have both indirect and direct impacts on people's health, right? It can make them feel unwell, but it can also increasingly lead to stress hormones in their body, which can then lead to increased risk of things like heart attacks, heart disease. So there are a number of ways that we can think about location and place, both directly and indirectly determining your health. So locations and places impact health outcomes, but so what? Why did we just spend so much time talking about this stuff? Well, where have we seen this happen? Have any of you ever encountered Hamilton's Code Red study? Is it familiar to some of you? Yes, yes. Good. So this is sort of the example that a lot of McMaster academics talk about, because it was really just such a critical study at the time that it was released in 2010. So this is just over 10 years ago now. But for those of you that maybe don't know or aren't familiar, it was a set of McMaster researchers, especially from this department, from geography, who teamed up with journalists from the Hamilton Spectator, and they published Code Red. So what they did was that they examined hospital data, emergency room department visits, for example, and they linked it with socio-demographic data, things like income, poverty, measures like that from the census. And they wanted to look at potential health inequalities between different Hamilton neighborhoods. So what they found was that some neighborhoods fared significantly worse than others. And I'll spend a little bit of time just going through a few examples. So in some neighborhoods, for example, 15% of the babies born, specifically between 2006 and 2010, had low birth weights. This was more than double the provincial rate. almost 3/4, so 74% of children live below the poverty line. This is more than 4 times the provincial average. Now, why am I bringing this up? Well, even though low birth weight in itself isn't particularly dangerous, we know that it can provide a lot of complications for the baby later down the road, right? So low birth weight is one of those sort of indicators of potential problems later on. We also know that 1/4 of the mothers, unfortunately, in Hamilton were smoking at the time of the beginning of their pregnancy. And so this also has significant impacts on things like low birth weight, fetal development in general. Moving on to another example, lung cancer. So if you see the little black circle here on the map, lung cancer incidence rates in that particular neighborhood were 3 times higher than the national average, and lung cancer mortality was also 3 times higher than the national average. You might be wondering, why might that be? Well, as we know, smoking is a significant risk factor of lung cancer. And of course, smoking rates were significantly higher in many neighborhoods like that in Hamilton. But also it could be things like environmental exposures, occupational exposures. We know, for example, in that particular neighborhood that there were a lot of industries there, especially 20, 30 years ago. And what we know about the latency of cancer is that it can take a very long time between the time that you're exposed to something like a lung carcinogen, like arsenic, let's say, or cobalt, or many heavy metals that are prevalent in industries. So between the time that you're exposed to them and then several decades later when you might actually have lung cancer. So this is why it's sort of important to think about these things. Now, the last example I wanted to discuss was this life expectancy. So there's a 21-year life difference that they found in life expectancy between Hamilton's 130 neighborhoods. And what they found was that poverty and low income were 2 of the biggest factors that explained the differences in their modeling. Why do you guys think that might be? Or why are we so interested in how poverty or low income could impact life expectancy? Any ideas for what the link might be there? Determines place. What do you mean by that? Lower levels of sanitation could become ill. Yeah. Access to healthcare services. Yep. Access to fewer resources. Yeah. So a lot of you guys are kind of on the right track there. Less opportunities. Yeah. So think about this from another perspective. If you're facing poverty, low income, if you're already sort of ill because you're at increased risk of a number of chronic diseases, you may also not have enough money to pay for things like drugs and prescription medicine, right? Those cost money. Those require often employment drug plans. And so if you are also unemployed, this could really kind of snowball a lot of these problems. So this is why we will spend a lot of time talking about, socioeconomic factors, social determinants of health. In fact, we'll spend a whole week of the course kind of unpacking those. So stay tuned. So where are we now 10 years later? Unfortunately, out of the 13 health indicators, 10 have worsened since the original study. Average lifespan declined in some neighborhoods. And 10 years ago, 57% of hospital admissions were urgent. Now 63% are urgent. Respiratory and cardiovascular emergency room visits have also significantly increased across the city. So, unfortunately, over the course of the last decade, we haven't really made a lot of those investments or policy changes that would have reversed a lot of the sort of negative results that they saw originally with the study, right? We're still facing a lot of these issues in Hamilton, as well as in numerous communities across Ontario and beyond. And we haven't necessarily chipped away at some of these issues. Interestingly, though, low birth weight was one of those indicators that improved. So at least there are some positives to sort of highlight there. Now, where else do we see this? Why am I bringing this up? It's also worth discussing these kinds of geographic health inequities in the context of Canadian First Nations communities. So even though Canada's First Nations communities are scattered across Canada, right, we may not think of them as having similar geographies. They, in fact, have very similar kind of socioeconomic inequalities, and they do have certain aspects of geography that do make them quite similar, right? They tend to live in very remote communities. They face a lot of the same access or barriers to access to resources. So they do have similarities from that perspective. In fact, I just read a news article yesterday that I thought I would bring up as an example today. In this news article, they were talking about how, especially during the pandemic, a lot of Inuk women, so women from Nunavut who are pregnant, have to go and deliver their babies in cities like Winnipeg or Edmonton or Ottawa, cities in southern Canada. And this is because there's only one hospital currently that's available that has the equipment to be able to deliver babies, especially babies with any sort of pregnancy complications. And so, as you can imagine, if there's only one hospital, many women can't access that hospital, not only because of distance, but because, you know, the place is full up. They don't have the capacity to possibly accommodate every single pregnant woman in Nunavut. And so in this particular news article, unfortunately, the mother ended up catching COVID in Winnipeg and she passed away. And so this was a really striking example of sort of the socioeconomic inequalities, because this would be unacceptable to many pregnant women who are pregnant, let's say in Southern Ontario. You know, they would never dream of being forced to relocate to go deliver their baby without the care and support of their family members, for example, go deliver a baby in a completely new province, a completely new sort of setting, let alone new province. And so this has really significant impacts on the health of not only maternal health, but also, of course, child health. And, you know, a lot of these things are very interconnected. Another thing I want to mention is the changes to traditional lifestyles, because this is, of course, a huge, huge issue with a lot of First Nations or Inuit communities all across Canada. Unfortunately, sort of our traditional Western diets have infiltrated a lot of these communities, and you know, with that, a lot of our bad habits, eating junk food and things like that, which unfortunately they can't balance necessarily with a lot of the traditional foods that they used to eat, because they don't have access to a lot of those foods anymore. So why am I mentioning this? You know, what kind of impacts has this had? Well, unfortunately, it's led to a lot of First Nations and Inuit individuals having significantly worse health than the average Canadian. So as you can see in the figure there that I've put up, this is looking at a whole host of health conditions, chronic health conditions that are pretty common among Canadians. And if you look at the percent of the population that's impacted, right, the prevalence of these diseases, you'll notice that they're often quite a bit higher among First Nations individuals who live on reserve compared to the general Canadian population. So we're not just talking about these issues because they're fun to talk about. They're definitely not fun to talk about, but they do have real life consequences, right? They do lead to actual differences in health outcomes that we can measure and that we can track over time. So these are important things to keep in mind as we go through the course. Now, health inequalities are often indicated by measures like life expectancy. And of course, we can see these play out all across the world. Now, the reason I bring this up is because even though life expectancy varies significantly within Canada, I should say, right? They vary across neighborhoods in Hamilton. They vary across different communities when you're looking at First Nations versus Canadian. It's easy to sort of pat ourselves on the back and say that we're doing a great job here in Canada when we sort of scale it up and look at the global context, right? Canada is in this sort of VIP group of nations that have a pretty high life expectancy, right? We're in the group with Australia, with nations from Western Europe. So it might be tempting to think that, you know, there are no health issues in Canada, we're doing a great job. But of course, this is why we like to break it down sometimes at smaller scales. That's why it's important to look at patterns that are going on within nations, not just sort of globally, because it can obviously tell a very, very different story. So this is to say that when you're looking at a global scale, right, you're comparing nation to nation, it can actually mask quite a few health outcomes that we're interested. It might not show the whole picture. So that's why we'll spend a lot of time talking about health and disease in the context of different scales, right? We're not just going to stick to national scale. We're going to also go down to far local, smaller scales. So as we start to sort of wrap up today's lecture, why does location and place matter so much? Well, by the end of the course, you should be able to apply what you'll learn here to help answer that question. As we've come to understand even just today, there are many factors, something that we call determinants of health, that have impacts on the health of populations. So we talked about some of them today, things like income, even employment we touched on, access to health services. Aging population is another that we didn't really get to address today, but that we will at some point. And of course, there are many, many other factors that we absolutely did not have time to cover in the first lecture of a course. So this is to say that you'll hopefully get an understanding of a lot of these factors, and we'll get a chance to talk about them in a lot more detail over the course of the semester. In summary, some locations have seen improvements, or they have seen changes to these factors more than others over time. And so that's something that we'll also kind of come back to a lot in this course. Now, something that I think is really, really important to highlight in the first lecture, because we will revisit this model a lot, especially in the first couple of weeks of the course, is this idea of the socioecological model. So this model is a very helpful framework to summarize all of these important factors on health that we've talked about, right? It kind of provides an easy framework to encompass a lot of these things, because on their own, it can sort of seem like, how are all these factors related? What do they have to do with one another? But in fact, they are all interconnected. They all play an influence on one another. And so it's important to keep in mind that even though we'll be discussing them separately, every week we'll talk about one factor individually, they are in fact very interconnected. And as much as we'll be treating them separately, they in fact are not separate. And it's really, really hard to separate them in the context of the real world. So gradually over the course of the semester, we will move in the circle. So we're starting this course in a couple of weeks after all the methodology stuff. We'll start by talking about things like population health, disease ecology, how the natural environment impacts health. And over time, we'll get to sort of the smaller scale factors. So things like socioeconomic determinants of health, right? Local economies, the built environment as well, we'll talk about later on in the course. And so we'll kind of go from the outer layers of the circle closer in. So this leaves us with what we'll be covering tomorrow. We're going to discuss ways that we can measure the impact of health, the impact of geography on health. We'll be contrasting qualitative and quantitative methods, and we'll examine different indicators of health. So what is also important that we'll talk about is study designs, and this is particularly useful for your assignment number 1. So you definitely don't want to miss tomorrow's lecture as well as next week's lecture, where we will cover a lot of stuff that will be very helpful for assignment number 1. Great, so that's all I have for today. Do you guys have any questions?